This video is going to be a compilation at different stages of my skin cancer, okay? The earliest videos I took of this process, I forgot to turn on the microphone, so I'm having to kind of go back and recreate it. As you can tell, we're not at the very beginning of this journey, but right now I've had 2 biopsies that showed 2 different types of skin cancer, squamous cell and basal cell, and I've had the surgeries to remove them, and one was by the Mohs surgery, and I had the repair from the Mohs surgery done. But now I think I found another one. So if the video title says 3 skin cancers, then you know that is the day I took this video. I wasn't sure. If it says 2 skin cancers, then my recent concern is nothing. So let's just hope. But if it is something, I want to get it taken care of. I'm still healing from my first 2 surgeries, but if there's more, I want it getting taken care of, because one of the cancers was squamous cell carcinoma, and that is frequently from actinic keratosis, which in itself is not cancer, but it is considered a precancerous condition, and it can sometimes convert to squamous cell carcinoma. So I had been treated for actinic keratosis in the past. That was not that, bad. They just went in and froze it, and it kind of scaled and scabbed and healed over, and then you had nice smooth skin underneath it. If you've never had actinic keratosis or you've never seen it, the pictures on the internet, some of them look like mine, but some of them did not. I really couldn't see it by looking in the mirror most of the time. I could feel it though. It felt rough. It felt kind of scaly. And I have some new ones that we didn't treat yet this year, because when I get all this cancer taken care of, we're going to do a more aggressive treatment on it. But we need to get the cancer all removed and healed up before we do that. So I'll talk to you more about actinic keratosis another day. But when they removed the first one, and that's the first little video I'll put in here after I'm done explaining it, it turned out that when it was excised, they got clean margins, but even the clean margins contained actinic keratosis cells. So it's kind of creepy knowing they're under there and I can't see them. So that's one of the reasons why I'm wanting to do this more aggressive treatment. But so this next video clip is the day after my first surgery. So I still have the bandage on, I take it off, and you can see it. The bandage was a lot larger than the surgical site, because by the time he was done, I was still bleeding a little bit, and so they wanted to put a big bandage on there to contain the blood. It's also kind of shiny because they added Aquaphor ointment on top of it, which is also, which is very shiny ointment. And, but, it looked pretty good. I mean, it didn't look horrible. I did not take any pictures of that one. Well, no, I didn't have, they sutured that one up on the day they did the excision. So there was it wasn't a 2-stage thing. And then, I've got some notes on it. Oh, in that video, I'm dabbing at it. I'm dabbing at it with a wet pad to kind of, I think it was a piece of gauze pad, I'm not sure. But it was a wet pad, and I was dabbing at it and trying to wash off some of the dried blood and some of the excess Aquaphor, because I needed to wash it twice a day, and then reapply the Aquaphor as, you know, as a barrier on it. So, also, I think in this video you can see some of the markings that were around it before he did the surgery, and so if you see anything blue, that's what it was. It was the surgeon's markings to isolate where you wanted to cut. So that's what this next clip is. Again, this next clip is pretty short. In it, I was testing out some sunscreen, so I've been able to cut out most of it since I can't hear anything anyway. But this next one was 9 days after the first surgery. So you can see it's looking pretty good. It's still kind of hard to tell what it looks like because of the black sutures, but it's healing well. And this is 9 days after surgery. This is now, I think, 11 days post-surgery. See if I can get close enough. And it doesn't look too bad, but it's still kind of hard to tell what it looks like because of the black sutures in it. This next segment is the day of my second surgery. Okay, so now the second surgery is in this area I've got covered by a Band-Aid right now. And that one was the Mohs surgery, in which they take off consecutive layers until they've got a clear margin of a certain size all the way around the edges and underneath it. And so you end up, it's kind of hard to tell in the video. I didn't realize because it was so dark and the ointment on it was so shiny. So I will see if I can clear that up with some post-production lighting changes or something. But if I can't, it just looks like a raw circle where the skin's been removed, so it's red. And I would say it's just a little smaller than the size of a dime, that circle that's removed. But that's what this next one is. Again, it starts with the big bandage, although there's not as much bleeding on this one. He spent a lot more time cauterizing the little bleeders around it. So, I don't think there's anything. I'm pretty sure this is the last little snippet I have to redo because there's no sound. This next one is the day after the initial surgery and after they had done the repair, putting in the sutures. Now, I was kind of confused. I was like, well, how can you, I asked him, how can you repair a circle? I mean, it's a circle. It was a pretty big size circle. And he said, don't worry about it. He said, the skin is very elastic. He said, what I will do is kind of tunnel underneath the skin to loosen it up from the structures underneath it so that it will move. He goes, and then I'll just pull it together and suture it. He goes, it will be plenty, it's small enough and elastic enough, we're not gonna have any problems with it. So afterwards, he told me that what he did is he did a scar line. He said, I'll have a faint scar going vertically. And then before he got into the round part of the nose, he brought it up and did like a little T-junction. So it looks like an upside down T. So they didn't have to pull the skin from the tip of my nose, which might make it look less normal. So he also, where is it? So I had been using Aquaphor on the first one up till then, and that day of the first surgery, they removed all the stitches from it. And on the Mohs surgery, he told me that to keep using the Aquaphor on this one to keep it moist for 7 days. But after that, I could switch to this ointment. Ugh, that's not it. Here it is. It's called Stratamed. Little tiny tube. He said it was over the counter, but they had it in their office and I didn't feel like going to the drugstore with a bandage all over my face to see if they had any. I didn't remember ever seeing it there. And a million years ago, I used to be a pharmacist, so I didn't remember it either. So it must be a product that's at least, you know, newer than 30 years old. But it's also a slightly shiny ointment, but it forms a slight barrier. It says it's advanced film forming wound dressing. So on this one right now, if you can see what it looks like, I've got that on this one now. So he said I could start using it on this, and then after some days I could use it on this. So I'm using it on both. I mean, this one still doesn't look that great, so I didn't want to show it at the beginning of the video. So that's where we are. Now I'm gonna go in and call and get an appointment to have them see if this other thing that I've now found is anything to be worried about. Okay, so now it has been 7 days since the sutures were removed on the Mohs surgery. So that makes that surgery 3 weeks ago. And the first surgery over here was 5 weeks ago. This one's healed up pretty good. This one still has a little scab that I'm treating with soaking it with a cotton pad with water on it to get it hydrated well, and then add a little dot of hyaluronic acid serum to it, and then cover it with some Aquaphor to kind of seal the moisture in. So it's getting there. At that last visit also, I had a little lump there that he froze to get rid of for me. And most of it came off, you know, when those skin cells, you know, just sloughed off. But there was still a little bit left. So I've been touching it up with just a little dab of toner that's got salicylic acid and glycolic acid in it to kind of break up the last of those. So it's almost gone, but not quite. And once that's all gone, then I can start healing it up better. But that's where we are today. We're getting there. Well, it's been a while now since I made that first introductory video because I've been really busy with everything. But today I'm going to do the last video from the skin cancer surgery. Okay, so let me see here. Okay, this one on the side, if you can see it, is the first surgery. That was a squamous cell cancer. And that one was 9 weeks ago. And this one up top was the basal cell carcinoma, and it's been 9 weeks. So, not really expecting any further healing, except that which will come in months or years down the road. So I'm gonna have to figure out like how to cover these up when I'm applying makeup. The other thing I was left with is this whole part of my nose is red now, where it wasn't before. So I guess the surgery has affected the blood supply in some manner. I'm glad the cancer's gone, but I had hoped I'd have less scarring. You know, I've got to get ready for the next phase, which is treating the actinic keratosis. Hopefully that's the last of my skin cancer. I've been very good this summer, applying sunscreen every single day and putting on my vitamin C serum beforehand. So hopefully there aren't any more. Oh, and I'd said in the beginning that I wasn't sure if this last one was a third cancer, but it wasn't. It was something abnormal, but it was nothing to worry about. So, but I'm glad he cut it off anyway. So that's it. So far, 2 skin cancers. Oh, until next time, thank you. Watching your silver mirror, okay?